Good morning and Happy New Year. I know everybody missed that song. I will tell you that my kids have actually really gotten excited about that that particular song when it plays in the car. And so, anyway, I know I missed it. I'm glad everybody is listening this morning. Welcome to the show. This is For the Health of It. I am Dr. Scott Phillips, owner of Lifestyle Chiropractic and Wellness Center here in the Clock Tower building on Main Street. And I'm excited to wish you a Happy New Year. Hopefully all of you have made your list of 600 New Year's resolutions that have to do with your health, and hopefully you're not going to abandon them by the end of this month, or maybe you've already abandoned them, I don't know. But basically, we are here the first of the month, or the first of the year, and I've missed you for 2 weeks. I woke up Christmas morning and thought, what would be better than opening presents with all my kids, and the radio show was not high on that list, unfortunately. And then I woke up a little later on New Year's Day and thought, well, I'm glad I didn't have it this morning because I would have missed it. So here we are, January 8th, first show of the year. We have a great guest. I started talking about the show as of Monday about what we're going to talk about today, and it's really exciting. We're going to talk about natural alternative to non-steroidal anti-inflammatory drugs, which are commonly known as things like ibuprofen, some aspirin, those types of things. And so we're going to talk about how you can get away from using those so frequently. And a great topic, I think, especially in the ski season. This is a time maybe where ibuprofen use in this area increases. I don't know. Anyway, so we are welcoming Miss Krista Clark on the show this morning. Krista, why don't you say hi to everybody?
Good morning, everyone.
Krista is a physical therapist here in Midway, and we're going to talk about her and her practice, and we're going to get rolling. But I wanted to make you aware of at least one event that I was made aware of. This is from a office here in town formerly known as Dance Addictions. They have changed their name to Studio Body Shop. It's in the same place. And I'm trying to get the link up here that's telling they've got a grand reopening coming this weekend. So it's actually on the 9th. So if I'm right, it's tomorrow. And so basically what they're going to do, yes, Friday, January 9th, they're going to have $5 Friday classes. So 9 a.m. is going to be a dance trance for $5. 10 a.m. they're going to do a ribbon cutting and a ceremony there for that. 10:15 they'll have some yoga, and then Saturday the 10th they're doing some free classes. So those of you that maybe do yoga or haven't gotten to try it yet and want to check it out, or check out some of this dance stuff that's going on, it's a great thing to do to get active. So Saturday on the 10th, that's this Saturday coming up at 8 a.m. they're going to do a yoga hot fusion, which is a free class. And then after that, they're going to do a dance trance for free. So if you want to come out and check out their ribbon cutting, that's tomorrow. They've got a couple of $5 classes. We want to come see those. And then Saturday, we'll have the thing also. So go out and support them. Again, their address, actually, I guess I should probably do that too. They're just over there kind of behind Chick's Cafe. And I'm trying to see here if I have an address. I'm on their Facebook page, so let's see. Oh, there it is, 34 West, 200 South, number 3. So, like I say, if you know where Chick's Cafe is, just behind them, across the street from the park there. So look for Studio Body Shop. They are making some changes, and actually, I'm slated to have one of the owners in next week. Stephanie Smith will be in here hopefully to talk a little bit about what they're doing over there. So that's about the only activity or event that I know of that I've been made aware of. So go ahead and go and support them. The next thing I want to do is read a little article that I was interested in, had a couple comments about also. So let's get into that. It was kind of a controversial article, one that I was really, again, I'm all about headlines. And as soon as those headlines come across, I think, hey, sheesh, what is this all about? So the headline came from a CNN article, and basically it is, well, I'll read it to you here if it'll load up soon. Here's the problem with internets and relying on them is it always takes longer than you want it to. So,
much information.
Well, exactly. I'm telling
It's
you.
available.
So here's what the article says. It says teen in Connecticut seeks right to refuse chemotherapy. So basically, because she's a minor, they can't say her full name, but she's identified as Cassandra C. And Cassandra C is 17 years old. She was diagnosed with Hodgkin's lymphoma in September. Apparently, she went through some chemo treatments and decided she didn't want to do them anymore. And so as soon as that happened, then the hospital in Connecticut actually called up the Department of Children and Families out of concern that it was medical neglect. And so basically what happened is they investigated and they requested temporary custody of the girl. She was removed from her mother's home, placed with a relative, then forced her to go back into treatment. Then apparently she ran away from that situation for a week or so. And so currently she is staying in the hospital. She has to be there. And she was they put a port in finally, and now they're giving her chemotherapy treatments against her will. So she has sought legal advice. She's trying to get the state basically to tell her that she's mature enough to refuse this type of treatment, that she can make that type of decision. And so I guess there's two kind of ideas at play here, Krista, and I'm excited to kind of hear. I know you haven't read the article, and so you're just, like everyone else, just kind of listening to the highlights that I've put in. But the two things that I hear are first of all, right to choose, right?
Exactly.
I mean, and right to refuse a treatment if we want. And then I guess the other issue is how old do you say, hey, this person's old enough to make that type of decision?
Mm-hmm. Well, and it's also based on an understanding or a thought that our system is the best system. And around the world, there are a lot of other systems that work with health and treat disease that are much more natural and much less toxic.
Well, and if people knew the actual, statistics about chemotherapy, how often it works, how often it usually doesn't work. But this is so medical experts actually testified in a hearing that got Cassandra taken away from her family, that she had an 85% chance of survival if treated with chemotherapy. And then if not treated, they said the girl faced a near certainty of death within 2 years. And I guess that might be where I have the biggest concern, is how often do they give someone 6 months, a week, and almost with this surety, like this is how long you have to live, and it's completely off.
Exactly. And it's so fear-based. When people are told that, it really changes how they respond, how their body responds. But again, in other countries, there are a lot of other ways of working with different diseases, and people need to be able to educate themselves and follow what feels best to them on a deep level.
Well, and my interest is, it obviously doesn't go into this in the article. And actually, they tried to get a hold of her and try to ask her kind of why she was refusing. But apparently, with her being a minor, they didn't include any of that. The prosecutor, her attorney said we're not going to divulge that. So I guess that's what I'd be interested in. Is she just saying, because really what it looks like is she's saying no to chemotherapy, so she's saying yes to death, and I think that's kind of what they're trying to portray this as. She's almost a committing suicide type of thing, like, hey, you're not going to get this treatment. But why does it have to be one or the other? I mean, we're aware of so many other ways to try to treat a disease like Hodgkin's lymphoma, which, like they say, is not, if you catch it in different types of stages, not necessarily a life-threatening condition. There have to be other ways to treat it. I'm sure she's not one that just says, hey, I don't want to do chemo, so I'm not going to do anything.
Exactly, and she probably has a very good reason for not doing chemo.
Right.
I like the saying, intuition is the inner physician.
Yeah,
and
exactly.
She probably has the sense that this is not right for her.
Especially because she tried it.
Yeah, she tried it, and she also may be researching other options.
Yeah.
So, and there's so much out there that people need to kind of sort through with the information to find out what's best for them. And at 17, it seems like with the guidance of adults, you can have a pretty good sense of what's going on. And even the cases that have been similar with younger kids where the family is looking at integrative care or alternative care, that it's based on a choice and an understanding that our allopathic system, our dominant medical system, is not the only way of doing things. And not the only right way.
And that there are many other options. There are many. It always kind of makes me angry, to be honest, when I see the legal system get involved, because like you say, what we have to operate under the assumption is that that doctor that's telling her whatever is 100% correct.
Exactly.
And that
that's not
he's
a
stating
fact,
right? That he's saying that if you don't do chemotherapy, you will die. Which, how do you take that as fact? That's what bothers me, is I think, how many cases do you have to bring forth and say, look, here's one where they said they died and they did something else and they didn't.
Exactly, and there are many of those.
Many.
More than we can know. But the idea that, to me, what's going to happen in our healthcare system, the strength is integrative health, is bringing together what we know is good in our allopathic treatment or the anti-cancer drugs, anti-inflammatories, things like that, and bringing together what we know works in the holistic and the natural system. So there are lots of herbs, lots of different substances that have been used, lots of different nutritional supplements and things like that have a good track record. And when we get into the information on the anti-inflammatories, we'll see that a lot of these have been studied very well in other countries, not so much in this country. And so there's good data out there that the other ways of approaching things work. So we'll bring together the best of what works with all of these approaches.
Well, and I think we're definitely getting closer to that type of model, for sure. I think closer than we were 10 years ago.
Exactly, and people are demanding it because they know there are other things out there.
So it's interesting, a case like this, you say, you know, what could she do? Again, there's the minor issue, but I always think it's interesting that, you know, she's probably more mature and more aware of what's going on with her as a 17-year-old as many 30-year-olds. You know, I mean, how can you just make it an age when we all develop and there's so much difference when it comes there? And I guess for me, I would like to see what her plan is, right? Because if she were to come to me and say, I don't want to go this route, but here's my plan of what I've decided to do, I just don't see how a court wouldn't look at that and say, look, she's doing her research, she's making her decision, and so now she's going to have to live or not live with it. But at that hands, I don't see how it's in the hands of the court and not in her own personal choice.
Exactly. And it shouldn't be in the hands of the authoritarian medical system that say this is the only way to do things.
Man, I'll tell you. Yeah. Well, anyway, I think it's interesting. It reminds me of the case in Utah. I don't know if you remember hearing about this. There's a boy, and he was younger. I think he was in his, 6, 7, 8 kind of range, maybe 9 years old to the oldest. And he was diagnosed, I think, with a certain form of leukemia.
Yes.
And his parents,
I remember.
Yeah, his parents said, we don't want to do the treatments. They put the authorities on him, and they actually ran. They fled. And they went to Idaho. And they hunkered down in Idaho. And I think, what was it, maybe a couple of years. If you guys don't know this case, it's incredible. Because a couple of years later, they go and get him checked out, and he's cancer-free.
Yeah, exactly. I mean, I've seen people who do... a woman with breast cancer couldn't get in for surgery, a lumpectomy, for a couple of months, and she started on other ways of working with the cancer. And when she did get the lumpectomy, they said it had shrunk. And they said, we didn't measure it right initially. But I think that for her, bringing together our system of the surgery and the drugs, and then the herbs and the different things she was researching was very helpful. And she decided not to do radiation therapy and kept up with the other things, and she's doing quite well. So there are different options. Luckily, she was an adult and could make that decision.
Well, and I'll tell you, it's just so crazy because that for me is, like you say, when he went and he was cancer-free, then they told him, it was a misdiagnosis.
Exactly.
Not a...
In fact, there's a book from these folks. Her husband did a lot of research as well.
Yeah.
They were both researching. There's a book called Cancer Think Outside the Box, and it's by Ty Bollinger.
Okay.
And I got the book. I haven't read through it yet, but there are resources out there for people to try and look at what's been researched, what's working, what's not.
Right. And cancer is a scary thing. I mean, obviously, the statistics are almost overwhelming at this point. I know this day and time they're saying about 1 in 2 males are diagnosed with some form of cancer in their lifetime, which is a lot. I mean, 50% is a huge number, and then females not very far behind. I think it's 1 in 3 right now.
Well, and the cancer rates have gone up exponentially, so much that you can't say it's just that we're living longer.
Right.
I tell my patients we're going to look back at this time with all our pollution the way we look back at medieval times where they threw the chamber pot contents out on the street below.
And thought it was fine.
Right, and you're going, what were we thinking?
Yeah.
Of course that's not fine. We now know that that caused problems, and we'll look back at some of our pollutants and
I completely agree with you.
Say this was a problem.
And I'm going to jump to a conclusion that when you say pollutants, you don't just mean the stuff that we don't have, that's outside coming out of our car, but I think pollutants on the inside too. The food, the quote unquote food that we eat,
all of the chemicals in our food,
right,
and all kinds.
Yeah,
of
I
things.
think you're right. We'll look back and say, "Good grief, what were we thinking?"
Yeah.
But hopefully that happens anyway. So Krista, again, now it's hard to even introduce you now that you've already had such a great time in the conversation we had before. But I appreciate your insight there. Hopefully anyone thinking about that article and wants to read a little bit more, I did post it on the Facebook page. So look for me, Scott Phillips, or you can look for Lifestyle Chiropractic. That's on there also. And weigh in on your own opinion. I'm interested. A couple of people. One person I knew just said, "Look, I don't care if it's medical treatment. I don't care if this or that. The court shouldn't be involved in personal decisions. If she even just decided, hey, I just want to be done and I don't want to treat it at all, that she should have that right to do that." And then someone else, kind of along the same lines that we're talking about, said, "Why is that the only option? Why can't she come with another plan and say, here's what we're going to do?"
Exactly.
And so, good comments. Any other interesting comments you guys have, please feel free to weigh in, and I'm interested to hear about what you guys have to say too. So let's get to Krista Clark again, a physical therapist in Midway. Your office is, tell me where.
It's 37 West Main Street in Midway.
So it's just on Main Street.
Right on Main Street.
It's a nice little house, isn't it?
It is. Yeah. It's been a dentist office and a house before. It's a good little office.
Good. And so tell me, I guess by way of just introduction, what got you to Midway, kind of where you did all your training, and I know, I guess, what people need to know is your philosophy is very different from probably your mainstream physical therapist, and you can kind of tell me how that might differ, how you've kind of brought in some of these other Eastern, or I guess if we want to call it Eastern, but let's say alternative types of practices into your office. Well,
I went to University of Utah, and then I went into physical therapy training at Chicago Medical School, University of Health Sciences. And after that, I worked all around the country. I lived in Chicago, worked in hospitals there, hospitals in San Diego. And then I started my subspecialty training of orthopedic manual physical therapy in a residency and fellowship in Kaiser in the San Francisco Bay Area. So my practice is a subspecialty practice of a lot of hands-on treatment with people who are having all kinds of pain issues, neck, back, shoulder, elbow, wrist, knee, ankle, hip, you name it, nerve pain especially. And I teach continuing ed for other physical therapists. So it's a little more hands-on. Now I do use exercise. I use a lot of self-help, but I like to change the mechanics of what's going on. And when we talk about the anti-inflammatories, you want to know why things are frictioning and inflaming and getting irritated and work with that.
Right.
So after that, when I was in the San Francisco Bay Area, I met a wonderful man whom I married. He was an acupuncturist and a marriage, family, child counselor.
Okay.
And that's what kind of brought me into the world of realizing there are a lot of different ways of viewing health and viewing treating disease. So the Chinese medicine way, Ayurveda is the Indian medical medicine and herbs, naturopathy, homeopathy. And then he actually passed away 7 months after we were married, and that kind of catapulted me into the further delving into the integrative health and the mind, body, spirit, how it works in health. I moved here from North Carolina after I set up a little integrative health clinic with an MD, a social worker, a Ayurvedic physician, acupuncturist, massage therapist. And actually, just the beautiful valley and the hot springs are what brought me here.
Hot springs.
I still have a dream of a integrative healthcare where we can take the waters, like in Europe, where they bring together the different systems, and most of them are around hot springs. And so someday maybe that will happen.
Now you had I remember there was an acupuncturist there in the office. Has that position been refilled? I know she moved away.
It has been refilled.
Good.
We had another one there, and then she's come back.
Oh, okay.
That's Zidi Hudyba.
Zidi's back?
Mm-hmm.
I know she's Polish. I need to go and talk with her because I speak Polish myself.
Wonderful. So, and then I started getting interested in the natural alternatives to anti-inflammatory drugs, and I started hearing actually from Dr. Tom Rosenberg, our knee surgeon in Park City, about how these drugs were affecting the musculoskeletal system, the joints and connective tissues. And he also talked a lot about anti-inflammatory diet, which maybe we can talk about that more at another time.
I know, like you say, that's a whole nother show. That's
it is, but it's important because what we're eating really affects our bones and joints and connective tissue.
Well, and I think the important thing there is we need to start to take a little bit of responsibility for this inflammation, right?
Exactly.
It's not like, oh shoot, I've got a bum whatever, and I've got to make sure that I keep this when on the other side, with the other hand, we're feeding the inflammation.
Exactly.
No, very important topic for sure.
Yeah. So what I want to talk about is a little of the research that has been done about the anti-inflammatory drugs. And so people understand when they're taking these, and these are again the ibuprofen, Motrin, naproxen or naproxen, sodium indomethacin or indocin, ketoprofen, and Celebrex. And then there are others that have different names, but they're all in the same category of drugs. And all of these studies have been published in medical journals around the world. So both the studies on here and the studies on the natural anti-inflammatories, they're not pulled out of the air. These are well researched. So one of the things that we know is that actually these drugs increase osteoarthritis now. And people take them for arthritis.
For arthritis, yeah.
And they do relieve pain, but they actually interfere with tissue healing, and so the arthritis gets worse. So there was a study done in 1995, and this was in London at the St. Bartholomew's Hospital, and they had 812 patients who were put into two groups, and one took the anti-inflammatory drugs and one didn't. And what they found, they looked at their joint space in the hips and knees, and they found that the people on the anti-inflammatories on X-ray had worse arthritis. And this was within, I think this was within 180 days or maybe a year. They followed them for a year. So it didn't take long.
Not a very long time.
That's not
for
a
sure.
long time,
No.
yeah. So there was definite joint deterioration in that group. And then another study done in 2005, this is the Rotterdam study. And so it was done in the Netherlands, and it took, it was 1,695 subjects, and half of them, these were both hips and knee arthritis, half of them were on the anti-inflammatory drugs. Now this one was the diclofenac, which is Voltaren, and the one before was on the, I think, Indocin.
Okay.
And what they found, and these are stronger ones. These are prescription. These aren't
this
over
isn't the
the
stuff
counter.
you get over the counter, sure.
But they're all in the same class.
Right.
It's
They
kind
do
of
the same
strength.
idea.
Yeah, a little bit different tweaking of the
Right.
information. But what they found is that after 180 days on X-ray, that the people on the anti-inflammatory drugs had more hip and knee arthritis.
So 180 days.
180 days.
6 months, basically.
That's it.
Wow.
Yeah. So it doesn't take long for these to start to interfere with tissue healing and start to have more damage. And the irony is that it makes worse the exact condition that they're trying to treat.
Yeah. Wow.
But it also, it covers up the pain, essentially.
Right.
So, and then, there are some other studies. One was in 2006. And this was published in an arthritis research magazine, and this was in the Netherlands, where they took bits of human donor cartilage and put them in a petri dish. And one of them had the anti-inflammatory drug in, and within 7 days that had more arthritis.
Wow.
And the other one, the control group didn't, the cartilage didn't have more arthritis. Now, it could be, you think if something's sitting around in a dish for 7 days, it'll get worse anyway, kind of like my fridge.
Yeah, exactly.
But the control group, the cartilage didn't deteriorate as much.
Mm-hmm. I mean, that's we should call those landmark studies. I mean, that's a very people. I think most people out there that take these non-steroid drugs, these anti-inflammatories, that's a big condition that they're treating.
Well, and they think we're kind of led to believe, especially through our advertising, that they're okay.
Right.
And they have their place for short-term use, or if people are really in pain. But they're the big guns. They're not. Right. They have a lot of side effects. So.
Right.
And then there's another study, again done in Britain, and you'll notice a lot of these are not done in the U.S. They're done in other countries. And it just showed that the indomethacin only helped the pain for about 4 weeks. And after that, people didn't really get a lot more benefit in pain relief. Right.
And I've heard that here, too, for sure. You know, people say, hey, I started taking ibuprofen. It was doing really well, and now I take it still, but it doesn't. Or they have to feel like they have to increase the dose.
Exactly. And so they're again, maybe getting some pain relief initially, but after that, the benefits probably don't outweigh the costs.
Sure.
So let me just talk about a few more of these studies. There's a study that shows that these drugs, this one was indomethacin, so Indocin, and the COX-2 inhibitors, which are the Celebrex. Right. And the other two were taken off. Bextra and Vioxx were actually taken off the market shortly after they came on in 1995 because of the problems.
Right. And Celebrex was taken off, and then they finally just said, well, let's put it back on.
So what these do is these two studies show that it interferes with tissue tendon healing. So one was 100 little rats, and they did little rat rotator cuff repairs on them. Poor rats.
Poor little rats.
And the group of rats that were fed the anti-inflammatory drugs, their tendons didn't heal up. And then another group of rats, 215 of them, they did patellar tendon surgery. I'd hate to be the surgeon.
That's
I know. Little bitty rats.
I wonder if have little instruments.
So, but again, what they found is the ones on the drugs didn't have the tendon repair. And I'm seeing people come in after surgery now that it used to be they were on them quite routinely, and now I'm seeing that they're not as much.
Good.
So the word's getting out. In fact, in the American Academy of Orthopedic Surgeons bulletin in 2005 actually recommended, if there's a suitable alternative to the NSAIDs for pain control, that be used.
To use that instead of the anti-inflammatories.
Yeah. And, after you stop them, that process reverses and healing does take place. But who wants to take something that's going to interfere with your tissue healing anyway?
Exactly.
And so the same thing with surgical fusion and fracture healing. These interfere with the bone healing.
Wow.
So those, I've got 4 or 5 studies that show that. And people who go into for spinal fusion surgery, they're not allowed to get anywhere near them because they know
because of how
it won't take. It'll interfere with tissue healing. And the main one was Toradol or ketoloric in that caused the most interference. And that's a very strong prescription one. I don't even see it prescribed that much anymore, actually. And then increased fracture risk. There was a study in 2000 that basically looked at people over time, and the ones who had been taking the anti-inflammatories had more fractures, long bone, spine, things like that. So you can see that these really, the way they work physiologically, really interfere with the tissue. Healing. And then I'll just talk for a minute about the side effects that we know that are more well known, because it's very well known that it causes digestive tract stuff, problems, ulcerations. They can cause kidney and liver damage, and there's an increased risk of heart attack and stroke, especially with the Celebrex and things like that. Another study, this one was done in 1999, shows that hospitalizations just due to the GI tract, the gastrointestinal tract, cost the healthcare system an estimated $2 billion a year to treat.
And that was in 99.
That was in 99, yeah.
Imagine it's gone up.
It may have gone up.
Wow. And that's just for the GI stuff from the anti-inflammatories.
Yeah, that's not kidney, liver, other
that's
things.
A lot.
And then there's another study. This one was in 2004, and there might be updated studies now, but it was looking at the deaths attributed to these drugs.
Right.
And the studies varied from anywhere from 3,200 to over 16,000 deaths a year in our country from these drugs.
Wow.
Okay. So, and then the long-term use over 3 months, which isn't that long, has been linked to with 1.4 times increased risk of erectile dysfunction.
Which no one wants.
No one wants. And that was done in 2005. That study came out.
That was just 3 months use.
Yeah, 3 months use.
Wow.
So, yeah, that should get people's attention.
Right. Good morning.
And then there was a study done. This was in the British Medical Journal in 2011. And it showed that the rate of new onset of heart atrial fibrillation, that's where your heart just kind of doesn't beat well, it just kind of flutters, was higher in new users of the NSAID drugs.
Yeah.
Okay. And then there was a recent study looking at hearing loss in women, and there's an earlier study in men that is associated with use of ibuprofen and acetaminophen, which is the Tylenol.
Huh.
So,
and that was hearing loss.
Hearing loss,
Interesting.
yeah. So it seems to affect somehow the physiology around the little hairs in your ears that help you to hear.
Right.
So, and these interfere with basic physiologic processes.
Well, and I think you're right. I think most people are aware of that. I see a lot of people in my offices, I'm sure you do too, that say, I don't really love to be on them because I know that. So I think these risks are starting to be a little more put into the forefront.
Exactly.
My wife actually is one that she was a headache sufferer all through kind of high school years, and kind of the same thing. Ibuprofen is so cheap and so readily available that you just think, well, if I can get it this easy, then why not take it?
Exactly.
And she would take it a lot. And actually, she when we were engaged, so about at the age of 23, 24, she developed a tumor in her small intestine.
Ooh.
And it was actually big enough that it ended up completely blocking her. And so anyway, so she had to go in. But the doctors wouldn't diagnose her with it because she was it was a weird age and all that kind of stuff that they just didn't think anything like that could happen. But then when they found that, and then she started to do some research on her own and seeing some of the issues that happen with long-term ibuprofen use, that she says, hey, that's where it came from.
Yeah.
And so I'll tell you that she is she's one that
very aware.
Yeah, I mean, just doesn't. So I think, and I love all that. So hopefully what we can do here is help people understand. Look, like you say, I don't think these were ever meant to be daily drugs.
Exactly. And you and I in our practices both want to change the underlying reason people are having headaches or pain or frictioning and inflammation. So that's the first thing, is to really look at the underlying reason, not just cover it up.
Yeah.
And I tell people my motto in my practice is not no pain, no gain. It's motion is the lotion. And we need to get good movement through our joints. And nervous system, connective tissue, in order to move freely. That's why the dance classes, anything that gets you moving, anything that gets you stretching appropriately. I have a YouTube video on, it's an 11.5-minute stretching program.
Really?
Back mobility and
Awesome.
full mobility, actually. So if you go on to Wellspring Physical Therapy, you can search for it, or my name.
I think that's the first time we said your office name. Sorry, Wellspring Physical Therapy.
Yes.
So let's talk about what people can do, because again, right, if you have something, an issue that you just need to maybe take one or two and it feels better, and then you say, okay, but if we're talking about someone that wakes up every morning with a headache, or someone that is stiff all the time and they feel like, man, I don't want to take these. Again, I feel like more and more people are saying, I'm not sure, I want to take those, but then what do I do?
Well, and the good news is there are lots of natural anti-inflammatories that have been used for eons.
Right. Most
of them are foods, actually, and so I'm going to go into some of that in the research. And the anti-inflammatories, they're well researched now. We have a lot of data on things that have been used for thousands of years medicinally, but now we know with our modern science why they work and what they're doing.
Right.
So the first one, and this is one of my favorite, is bromelain. So bromelain is from the pineapple plant, and it is a natural anti-inflammatory. You get it by eating fresh pineapple. Yeah. Sometimes you have to eat a lot of fresh pineapple, but canned pineapple won't work because the heat of canning has taken the bromelain out. So, and it's been used at least since 1957, and there are more than 200 scientific papers on the application. So what I like about bromelain is anti-inflammatories interfere with the tissue healing process because we have tissue damage and then tissue repair, and actually the white blood cells that are part of our inflammation system are also part of our immune system.
Right.
So they're the same hardworking little white blood cells there that are helping to repair the damage to tissues. So the anti-inflammatory drugs kind of early on start to interfere with that repair system. But the bromelain, after your body's repaired, it comes in and helps clean out the excessive fibrotic tissue. Now, fibrotic tissue is a little like internal scar tissue.
Right.
And our body will make a little bit more than we need. And sometimes it sticks around and gums up the works. Yeah. So the bromelain actually helps the inflammation by breaking down that fibrotic tissue and cleaning it away. So that's why it's nice that it helps with pain, or it helps with your body's repair system. So there's a cool little study done in the Czech Republic, back when it was the Czech Republic, in 2002, and it was in a trauma center where people would come in with long bone fractures, so arm bone, thigh bone, things like that, and some would have surgery, some would not. One group was given the bromelain combination, and the other group standard pharmaceutical anti-swelling drugs or anti-edemic drugs. Right. And the group that got the bromelain had less swelling 2 or 3 days down the line than the ones who had the standard pharmaceuticals. Wow. And they both groups got to request pain meds as they needed them. Yeah. And so what they found is that the group taking bromelain actually requested less pain meds. So there's thought that it also helps with the pain. So, but the way it works physiologically is just quite cool. Yeah. So I like that. And again, you can get bromelain by eating fresh pineapple. Sometimes you have to eat a lot, and it's in a lot of supplements. There are combination supplements that you can get at any health food store. Right. And then there are bromelain, tablets that are just by themselves. Just bromelain. Yeah. Yeah. And when I tasted it was a chewable tablet. It tasted like a fresh little burst of pineapple. Yeah. Yeah. So it's a very cool alternative. And then very large doses have been given with no side effects in some of the studies. I think, the great thing. Yeah, yeah.
Because I love pineapple.
Exactly.
Now I have another good reason to eat more pineapple.
To eat more, yeah. So, and then the next one is capsaicin, which is basically cayenne pepper. Yeah. It's the oil of the hot chili pepper, cayenne pepper. And it's found in a lot of topical preparations, a lot of ointments and things like that. Yeah. And also you can get it in orally by mouth in concentrated substances. Sure. So
and hopefully those don't taste like chili peppers.
I think they're encapsulated, so they're not so
dialed
hot. Down. But they help a lot of things, a lot of pain. They've been shown to help pain in post-amputation and diabetic neuropathy, post-mastectomy, post-herpetic, like herpes. The pain after that, the neuralgia. So and cluster headaches, osteoarthritis, and rheumatoid arthritis. So the one I use in my office is called Sombra, and it's got some camphor and menthol, so it kind of cools.
Yeah, yeah.
It smells like your grandmother's medicine cabinet, and then it warms up. And it's not as strong as some that you have to be really careful if you touch your eyes after, that'll really heat up.
Sure.
So this is one of my patients' favorites. They like the Sombra a lot. So one of the other things is that it also helps with reducing cholesterol, triglycerides, and peptic ulcers, stomach ulcers. It's been shown to help all of those things. And what you find is that these natural substances help a lot of different conditions.
Isn't that the great thing?
It's not just one thing. It's because it's supporting your body's own healing process and own process of health.
Yeah, you say, hey, I'll boost this specific food or for this specific reason, but then all of a sudden, oh, wait, but now I'm getting these other benefits also.
Exactly. And even some of these have been shown to help possibly with cancer. Because, again, your body is always fighting cancer cells and your immune system. So things that help the immune system function better help your body fight any disease. Right. So anyway, the other interesting thing about the hot pepper is that even though it's spicy, it's actually not it actually stimulates the cooling centers of the hypothalamus in the brain. And that's why in tropical countries where it's very hot, they actually eat hot food because it stimulates their body to cool itself. So that's kind of interesting. And the other thing is that people with active ulcers might be bothered by the spicy foods, but they don't cause ulcers themselves.
Yeah, and I think that's something that people kind of think is a myth, like, oh, it might, but it's not going to cause it. In fact, this one helps to heal it a little bit.
Exactly. So the next one that I love is curcumin, which is found in turmeric.
Yeah.
So, and that's in your curry dishes. And this has been studied. It's been used in India and Asia for thousands of years. And it is basically, one study shows it is as effective as cortisone in decreasing acute inflammation. Not as effective in chronic inflammation, but
but the acute stuff that someone says, hey, I need a interesting.
Yeah, I thought that was a very interesting little study. There was a study done in Bangkok, Thailand. This was in 2009 that showed that the curcumin, which they make these things, you don't want to have just the oil, just the active ingredient. It's the whole curry powder, all the different ingredients that work together. But what they found is that the turmeric preparation was as effective as ibuprofen for treating arthritis. So, and you can safely consume quite a bit, but it's hard to eat that much curry.
Yeah, no, I can imagine. So if there is a, limit or whatever, you got to be really trying hard.
So you can get them, again, prepared at natural health food stores and in capsules and concentrated. And usually it's formulated with bromelain. So because those two seem to work well together. And there is a very cool book called Healing Spices. It's by Bharat B. Agarwal. And he is a researcher at the MD Anderson Cancer Institute in Houston, Texas.
Wow.
And he's of Indian descent. And the book is called Healing Spices. And it looks at all of the physiologic mechanisms of why our commonly used spices are helpful to us. So that he had published a lot before the book, and some of these studies on the curcumin and capsaicin and things were done by him as well. And the other thing is ginger is a good anti-inflammatory. So ginger, you can actually take slices of fresh ginger and put them in a thermos of hot water and make a little ginger tea.
Oh, yeah, sure.
And then as it cools down, add a little honey to it. You don't want to heat honey.
No, because it takes away all the...
So I tell people, first of all, eat as much fresh pineapple, hot pepper dishes, curry dishes as you can.
Yeah.
But beyond that, you may need to get some concentrated supplements to help with this. And there's one brand that I've been using for a while called Nature's Plus.
Okay.
And but any health food store will have different combinations of these. Yeah. So that's Ultra Inflammactin. And then the next one is Boswellia, which is frankincense, and Gugolipid, which is myrrh.
Yeah.
Those are both good anti-inflammatories. Now, they're shrubby trees found in the Middle East, so it's hard to eat them. So it's better to get them as a...
So if we're talking about getting a whole food source of frankincense and myrrh,
it's probably better
a little more difficult.
to go to the health food store. But so the Boswellia, frankincense, and myrrh, I guess if you have enough gold, it's all anti-inflammatory by then, so why not? But these have been used for thousands of years, again, as anti-inflammatories. There are some studies done in India in arthritis camps where people come with arthritis and they're given the Gugolipid and a couple of other combinations that are quite helpful with that. And those are in most of the formulations that you see in the health food stores.
Now, I know those are two very commonly used essential oils. Mm-hmm. Is that also kind of, could you use that in the same sort of sense if you had a frankincense oil, for example, and use it topically, or have you seen anything like that?
I think it could be helpful topically. Yeah. Most of the research I've looked at is internal.
Okay.
And they're formulated and prepared a certain way for internal use.
Right.
But the topical, your body absorbs things. And I have my litmus test for a lot of these things is if it is very low possibility of side effects and pretty good probability of help.
Right.
And it's not so expensive that you're not really mad if it doesn't do a whole lot. Unlike some of our pharmaceuticals where people are paying $300 a pill for something
that hopefully works.
Yeah, that may work,
may or may
has
not.
awful side effects maybe.
Yeah.
So that's kind of what I tell people. You want to look at that also and see and try some different things because everybody's a little different in what works for them.
I think what I like about these studies that you're pointing out is maybe the issue that some person might have is almost this stigma of, drugs are manufactured and they're made to do a certain thing. Food just might do it or might not type of thing. And maybe they're a little concerned that, maybe that's good in theory, but, when I have a headache, I don't want to reach for my pineapple. I want to reach for something that's going to be fast. But I think some of these studies that are showing that they can be as fast-acting, they can be as and then you're getting away from the side effect issue.
Exactly, and they may not be as fast-acting, but they are helpful in the long run.
Right, in the longer run, taking care of things.
One of my things I try and stay away from is man-made molecules. If it's not found in nature, and this goes for some of the pharmaceuticals and some of the food additives. If it's not found in nature, why are we eating it?
Right.
Same with the artificial sweeteners and things like that.
Right.
So I really try and stay with, I think most of what we need is found in nature.
Yeah.
And we need the other occasionally, but not as the foundation for our health.
Right. If that's the first thing we look for is the man-made components, then maybe we've missed kind of. And like I say, I think a lot of people don't realize that they're using man-made components to make themselves ill and then trying to use man-made components to counteract that issue, when really what they could do is look at it and say, hey, if I cleaned up some of this stuff in my own personal life, in my nutrition, in my activity, all those types of things, that then I wouldn't need the other thing, and then we can cancel out all of our man-made stuff anyway.
So true. I mean, it has its place in the pharmaceutical world, but not, to me, it's not the first line. It shouldn't be the first line.
Definitely.
So, and then the last thing I want to talk about are homeopathic remedies. And these are actually the first thing I turn to when I fall off my mountain bike or hit a tree skiing and break my ribs or, tweak my back, gardening or lifting or things like that. And homeopathic remedies, they were started actually by a guy in Germany in 1755, or in the late 1700s. This system was developed, and it was really in a response to all the toxic things they were using at that time in healthcare. So this system has been around for a long time. It's been basically dissed for the last 100 years by our medical system because they don't know how it can work. Because what it does is take a substance that if you were to eat, say, Arnica montana, which is a mountain daisy found in the Alps in Europe, and if you were to eat this plant, you'd feel bruised and strained and uncomfortable.
Yeah.
But what they do is they dilute it down so much that there's nothing really left of the herb.
Right.
There's kind of the essence or the imprint of it.
Yeah.
Now we know with our quantum physics and a lot more science how this can work.
Right.
Whereas 100 years ago they didn't. But it spurs your body's healing system.
Sure.
And the irony is, our whole immunization system is based on the same principle of taking a dilute substance of what would cause the problem, and that spurs your body's system to fight it or to heal it.
Sure.
So it's not that far off. And again, non-toxic, over-the-counter. So Arnica montana is for strains, sprains, and bruises.
Yeah.
And it's actually the first thing you take homeopathically for fractures.
Yeah.
When I hit a tree skiing and broke my ribs, I realized that there's really nothing left in our Western medicine system that promotes tissue healing.
Right.
The anti-inflammatory drugs interfere with tissue healing. The pain meds cover it up.
Right.
And muscle relaxants actually work on your brain, not on the muscle.
Right.
So we really don't have that component very much
Nothing
in
really
the Western
spurs
system.
the healing. Nothing gets it going.
But there's a lot in the world of herbs and homeopathy and supplements that do.
Yeah.
So the homeopathic Tramiel is another combination I use a lot. It's got arnica and some things for nerve pain and other things.
Yeah.
It's made by Heal. There are some things that show that there are a couple of remedies that are helpful for arthritis, Zeal, and then there are just arthritis formulas. If you go into a health food store and ask about the homeopathic, you'll see the different remedies and what they're for and the symptoms that they're made for. Sure. So that's a nice way to go, and the combination of the herbs and supplements and homeopathics seem to work quite well for a lot of people.
Yeah.
So those are the kinds of things that I've found in my practice that seem to make a big difference for people and help them find a way that might support their own body's healing systems, because we have amazing healing capacities.
Right.
And what we want to do is support that and help it. When I see somebody who's got an acute injury, and I see people after fractures and things like that, what we want is to help it heal in a nice, mobile manner, not a stuck, painful, frictioning manner.
Right.
And all these seem to help with that as well.
Motion is the lotion.
Exactly.
The one comment I wanted to highlight that kind of when I first started talking about this show, someone was very interested about kind of headache relief, migraines specifically, and just said, man, there's just nothing else. I've tried all kinds of things to try to help these migraines go away, and there's nothing else that goes better than the Excedrin, especially Excedrin with the caffeine, all that kind of stuff. People say, oh, I've got a headache, I've got a migraine, I need to reach for the caffeine or whatever. And I think the conversation that we had kind of right before the show was a really good one in that maybe these, the over-the-counter pharmaceutical type drugs, like you say, maybe they work a little faster. Maybe they take care of the pain a little bit, easier, whatever you want to say. But if this is a recurring issue that say, hey, every, couple of weeks or couple of days or however often or even couple of months, I get this, awful migraine headache, and the only thing that helps us is this. Again, I think we have to talk to people about this proactive model instead of this reactive model.
Exactly.
And say there's something in your body that's saying, hey, every 2 months or every 2 weeks, I get to the point where I can't handle anymore, and I give you this wonderful migraine headache that makes you have to go into a dark room and all this kind of stuff. Yeah. And so I think maybe if that's what people are wondering, saying, hey, well, sure, it sounds great to just eat pineapple, but that's not going to take care of my migraine. Maybe say, well, if you're eating pineapple or you're doing some of these other things, instead of waiting for the actual event to happen.
Exactly.
Because the inflammation in the body isn't just there right when the headache happens. And I guess maybe that's an important thing to highlight, that's something that's in your body that's continuing, like I say, that you may be fueling with other means.
Yeah, and migraines have such a combination of things.
Right,
There's the chemistry in the brain, but most migraines have a upper neck joint component that gets involved, and then a lot of other types of things that add into it. So when we can work with the upper neck component, the joint part, and then the dietary part, because a lot of people, they'll have dietary triggers of migraines, and then look at some of the anti-inflammatory parts, and then save the big guns for when you really need it. But I've seen people who've really been able to decrease the frequency and the intensity of their migraines by these other means.
And so I guess, and that's what I would say is let's start trying to figure out from your body why these events are happening.
Exactly, not just cover them up.
Because even if it's, I'll see someone that says, I throw my back out once a year. And so they're very reactive about it, right? And I come into a chiropractor or a therapist or whatever, and I take care of it, and it takes me about 2 weeks, and then I'm good for the next year. And I think, but even that is this, again, finally the body's saying, hey, I'm fed up with it. I've got to, if there's something that recurs like that, there's got to be something at the core that you can find out what's going on.
Exactly. And so much of that, I tell people that it's kind of like dental care. You don't not brush and floss for a year and then wait for your teeth to be so bad that they have to be pulled. The Motion is the Lotion program, or the little bit of stretching, core stabilization, strengthening, mobility makes a huge difference. And I tell people it's like brushing and flossing. A little bit you do every day makes a huge difference to how you feel. And a lot of times that will take away when things get so irritated and tight that it goes out. I mean, we'll all have our injuries and things like that, but there are ways to really prevent it. But it takes dedication, or it takes getting into a routine. I tell about my dear old dad's back, who he wanted to enlist as a soldier in World War II. And as a young man, his back was so bad because he'd squashed probably 3 disc levels trying to show who could pull up the most weight on the grain truck scale on the farm where he grew up.
Had to be some sort of.
And after he had gotten years had problems with his back, and he was saw an orthopedic surgeon who said, we can't do surgery, but there's an exercise program you can do. And it was quite progressive for its time. And basically he said, if this is what I need to do to feel good, this is what I'll do. And almost every morning he spent his 15 or 20 minutes doing his routine, and his back never shut him down again. So people can really take much more hold of their health care and how they feel. It's not just random how they feel. It's a lot of times we have a lot more say in it than we think, but it takes getting into routines that work for you.
And that's honestly, as a kind of closing thought, again, our hour always seems to go by shorter than we think it will, but that's one of the reasons this show exists. That's one of the reasons that I'm super excited to have you on, Krista, is because I know that's what you believe, is that when we can realize that, hey, I can be as healthy as I want to be, how dedicated I am to that. Or am I to that? And we can see some of these issues, whether they're chronic, something, man, I wake up every day with a headache, or, hey, every once a year something happens. Those are still things that the body is saying, hey, what can you do to help me out?
And there's research that shows that exercise, and there are very certain forms that help everything, help everything in our health. So that being active and finding things that you love to do, whether it's walking, skiing, snowshoeing, biking, things that keep you active on all levels is very important.
Well, I think what we'll say then at the end is if you're one that suffers from the chronic pain and you're just popping those anti-inflammatories like crazy, hopefully you're realizing that it's probably not a great idea. And I hope we've given you some really good ideas to get out there and start using some of these alternative things and starting to see what they can do for you. And then if you're one that just, hey, I'm the occasional user, but it's still something that's kind of regular, I think we should all be very interested and curious about the level of inflammation in our body, because, like you say, there's so many things around us that promote inflammation, and diet is a big one, and I think we'll talk about that for sure. We'll have you back, and we'll talk about that anti-inflammatory diet. But that's really one of these issues, that the constant inflammation in our body is making some of these issues, whether they're regular occurring issues or just every now and then type of an issue. But these are such simple things that people can start to do, such easy, I think of myself, I love, kind of sprinkling chili powder on things. I put them on my eggs the other day and love that. Pineapple, obviously something that everybody could eat. Turmeric as just something to sprinkle on things is a great, thing. And so anyway, I love all the ideas we've had. Hopefully we've given you some clue into what you can do yourselves. Krista, again, thanks for coming on. Tell us one more time, what do you have burning here for the end?
Okay, so Wellspring Physical Therapy in Midway, and on my website you can actually download a PDF of this information.
Awesome.
So wellspringptut.com.
It's like Wellspring PT, like physical therapy.
Is in physical therapy.
And then UT for Utah.
.com, and then you can download the PDFs that talk about this and the anti-inflammatory diet recommendation.
Awesome.
So
check that out. Krista, again, great to have you. Good to have you here in the Valley. Thanks for coming on.
And thank you for having me.
And everybody get out and be healthy. It's, we're unseasonably warm for some reason. So if you have the desire, get outside, do some snowshoeing. Like Krista was saying, skiing is a great time right now. Go out and be healthy. And if you do it for no other reason, just do it for the health of it. Thank you for listening.